Okay, welcome. Today's webinar is an introduction and or overview of the Kinesio Taping Method for neuromuscular disorders. And our specialist that we have today is Ellie Spriet. She's gonna share with us her expertise and just more information about this. And then after Ellie is done, we have Laura Badmaev on the call today to share her parent experience with us. So Ellie, I'm going to hand it over to you now.
Excellent. Thank you so much. Let me share my screen. All right. Can you all see that okay? Great. Well, thank you so much, Sarah. Like she said, my name is Ellie. I'm an occupational therapist, and I'm also certified in the Kinesio Taping Method. And I'm also a yoga teacher. I have a lot of experience in both pediatric and adult neuro rehab, ortho, etc. I've worked in pediatric and adult hospitals, and most recently, my experience was at the Napa Center in Boston, which some of you may be familiar with. I no longer work full-time at Napa. I jumped into the nonprofit world, but still am an OT at heart and looking to share my expertise and the beauty of the Kinesiotape. So I'm excited to share with you all today. Here are the learning objectives that I hope you all will take away from our session together. Really, it just comes down to understanding the basics of kinesiotaping, including principles, techniques, and mechanism of action. I'm hoping that you can explore the therapeutic benefits of kinesiotape in pediatric populations, including things like pain relief, joint stability, muscle activation, and alignment. And then finally, give you some tips and tricks for learning to apply and remove it safely and effectively, and also an emphasis on the precautions and maybe some contraindications for using the tape with the pediatric population and adult population, actually. So to start, what is kinesiotape and the kinesiotaping method? Kinesiotape, you can also see it referred to as kinesiotext tape or K-tape. It's an original elastic adhesive tape developed by Dr. Kase in the 1970s for his specific kinesiotaping method. You'll see 4 different types of tape available, and it also is based on attention and skin sensitivity. So you might see a text tape, a light touch plus tape, a classic tape, and a performance plus tape. So I'll have some visuals. So classic tape will always have classic written on the back. You have a performance, which also will indicate on the back performance plus. Text tape is often the most utilized tape. And then you have text tape light touch, which is really excellent for the adult, geriatric, and pediatric populations and those with super sensitive skin. So this is one that is often used in pediatrics because of its sensitivity. So something to keep an eye on, and not often something that people are even aware that it exists. All of the kinesiotapes are 100% cotton fiber. They're 100% latex free. They are water resistant. They're hyperallergenic, and they're multiple day wear, which is really excellent because a lot of these kids with neuromuscular disorders have some other comorbidities or allergies or sensitivities. So this is a great modality to utilize for those kids safely without having to worry about some other contraindications. Essentially, what the tape does is it provides a tactile sensation in addition to other active therapeutic benefits to promote healing, decrease inflammation, improve muscle activation, or decrease muscle overactivation, and also providing that tactile cue to the skin because you've got that tape adhering, which is really excellent. This is one time, well, I will say that not all tapes are created equal. So you've probably seen other off-brand kinesio tapes or athletic therapeutic tapes out there. This is a time where I will only recommend name brand. I don't often do that. This is really important. Dr. Kenza Kase created this tape specifically. They are not all created equal, and they are missing other therapeutic benefits, and they are not created in that same like 100% cotton fiber, latex free, etc. So something to be aware of if you are going to use it or have a therapist use it with your child is to make sure that it is Kinesio brand. So you'll see that Kinesio brand there. That is very important. One of the other things about Kinesiotape that's really great is that it doesn't limit range of motion. So it supports joints, it supports muscles, but it doesn't restrict any range of motion. And because of its multiple day wear, you can wear it during therapies, during exercising, during bathing, just kind of through all your daily activities and daily life, because it's not inhibiting any range of motion. And because it is hypoallergenic, it doesn't have as much kind of wear and tear on the skin as well. Another plus is that Kinesio is manufactured in the USA, and it is registered as a medical device, is something else. That's just kind of a nice plus to it. What is the Kinesio taping method? So this again is Dr. Case's specific method that he created and that he created the tape for. Essentially, it's designed to facilitate the body's natural healing process while supporting instability in muscles and joints without restricting the body's range of motion, which we kind of discussed. So essentially what you do is you're going to apply the tape to the skin, and the tape is going to help lift the skin to activate that fascia, so that level below the skin and above your muscle, and also support the muscles to decrease inflammation and heal the affected area. So as a result, sometimes you see improvement with bruises and lymphatic drainage as well, and swelling, in addition to that muscle activation or muscle overactivation that it can help support. As a result, it's really excellent to assist with neuromuscular inhibitions or impacts of neuromuscular diseases. It can help with orthopedic injuries. It can help with neurological because it gives that really great tactile input that supports proprioceptive awareness, so where your body is in space, and a variety of other medical conditions that we could go on, but I don't need to for the sake of this webinar. It is safe for use of both pediatric and adult populations, particularly with the use of the correct tape that's more malleable for skin sensitivities. You can also use it to treat muscles, the joints, the fascia, the ligaments, the tendon, and the skin. So lots of applications here. Some common cuts that you might have seen on Kinesiotape. Oftentimes people's first thoughts of Kinesiotape are on like Olympic athletes. And so you might have seen these kind of like on those Olympic athletes, specifically like volleyball players. But again, it's not really just made for those professional athletes. As a general rule, you'll use specific cuts for specific types of injuries and treatments. So typically you'll use an I cut or the Y cut or the X cut for muscles, for joints, and for tendons. If you're supporting fascia and fascial movement, you're often going to use a web cut and a basket weave because those slits in the tape help support kind of that movement in the fascia layers. And then finally, the fan cut is often used for lymphedema and swelling and bruise management. Something else to note about the cuts of Kinesiotape is that every roll is 2 inches wide or 5 centimeters. And on the back, they're all 2-inch squares. So it's helpful for measuring and just kind of having an eye on the tape when you're cutting to use those squares. You can buy them either pre-cut or just in full rolls. For the pediatric population, I actually think it's easier to buy a full roll because their bodies are not going to be kind of that same pre-cut necessities that you would get. You're going to have to slim them down anyway. So more bang for your buck, I'd recommend getting a full roll for those pediatric populations. So that being said, what are some of the therapeutic benefits for the ASXL population? One of the first benefits that we can utilize Kinesiotape for is to promote muscle activation. So this could look like something like taping the muscles to increase activation in order to engage in a functional or activity. So for example, we could tape the abdominal muscles for more activation so that the kid knows to activate those muscles and then help with maybe a supine to sit transition. Or they're taped, and once they're up and sitting, they realize that they need to activate the abdominals to kind of stay in that sitting position or stay standing and activate that core. We can also tape the pectoral muscles here, and that might help with supporting self-feeding. So we can kind of tape it to help support muscle activation, to give that cue to the muscle of say, hey, turn on. And because so many of those ASXL kids have that lower tone and they don't know how to activate or they fatigue more quickly, the tape can be a great reminder and a great way to activate the muscle without giving a more intensive modality, such as like an NMES TASES with a stimulation. A second way that we can use the Kinesio tape is for decreasing pain or discomfort. So like I mentioned earlier, kinesiology tape can be really helpful to support overactive muscles. So those muscles that are overactive, so maybe in that hunching position, and they're maybe having some pain and tightness in those trapezius muscles, we can tape the muscles here to cue the body to relax down and decrease that overactivation to promote comfort. That's one of my biggest things as an OT. I think that we often under discuss any pain or discomfort that some of these kids might be in due to their neuromuscular comorbidities or the way their body is, just as a result of everything they've got going on. We're so focused on like supporting ADLs and helping with walking, and all of that's really important, and supporting play. But also, what about supporting just comfort in their body? And I think that's one of the really under discussed things in pediatric therapy. And I love the use of kinesiology tape to support that discussion and really support the kid feeling more comfortable in their body. And we can do that by finding those areas that are providing discomfort and taping them to support to provide more comfort. So that could be the trapezius, that could be on their back. And even like for joint mobility or joint contractures, we can also tape those areas too to support a little bit of relief that these kids deserve. And maybe they also don't know how to display that and how to convey that. So that's something that we can do as adults in their life to support that. One of the other ways that I just kind of mentioned is supporting joint alignment, and not only for discomfort, but also for engagement. So we can support the joints to be in a more optimal alignment in order for a child to optimally engage with their environment. And this could be for taping their wrists so that they can maybe grab a spoon or grab a paintbrush to engage in painting and playing, or grab a toy that's really exciting. It could be even taping a finger for more isolation so they can activate their AAC device so they can communicate their needs and their expressions and their excitement with us. It could be promoting taping their ankles so they can stand for a longer period of time to be upright with their peers and their environment. So there's a lot of ways that we can use it in a really low-tech way to support kids to be able to engage with their peers and feel more comfortable in their body. One of my other favorite things about Kinesio tape is that it provides that tactile cue. So the tape is cueing the body to do the most optimal thing to engage with the activity. And that means I don't have to cue as much. And nobody likes being reminded, and nobody likes being told, hey, turn that muscle on, or tell me how to do this, or don't forget about this. Like, no one likes that. And if I'm using tape, it means that I have to cue less because the tape is doing the cueing for me, and I don't have to tactilely touch the child, and I maybe have to use less verbal cues. And that can be so supportive for a relationship with a child, either as a parent, a caregiver, or a therapist, to provide less cues to a kid and help them kind of learn how to do it with a little more independence. So how do we apply tape, and what are some precautions? First of all, like I mentioned, there are 2-inch strips, and I would recommend doing a patch test with 1 or 2 of these blocks on the tape. So we're not gonna do anything more than just cut the tape, stick it on an area of the skin, and check for sensitivity. I recommend putting it on the area of the skin that you would like to tape if feasible. Sometimes it's not. Like if I want to tape a wrist and the kid's going to be doing all sorts of things all day long, maybe not the best place to patch test, because I don't know if the tape is going to stay on very well, just when I'm not applying it therapeutically. So if that's the case, then I would recommend applying it to the abdominals, check it in 24 hours, and see how the skin is responding. We always apply with no tension, so you're just going to peel the tape, stick it on the skin, and leave it for 24 hours. Other precautions to kind of look for and contraindications. So obviously we never want to apply tape on broken or damaged skin, so just something to be mindful of. We never want to apply tape on an area of active cancer. It's not totally contraindicated for cancer, but if there is that is a diagnosis that a child or adult carries, and we always want to check in with the general practitioner about that. Pregnancy, again, is not contraindicated, but we always want to check in with both the client and with their OB to make sure that everything is safe and stable, because of that lymph drainage that the tape can provide can be kind of difficult. So we always want to check in and make sure that it is a safe thing for us to apply. The same applies for the diabetes and a DVT. Again, because we're promoting drainage through the muscles, we want to make sure that it's safe and supportive. The final thing to really be cautious of is tension of tape. So all Kinesio tape has tension within it. So if I pull this off, you'll see it recoil right away because there's 10% tension built into all Kinesio tape. And that's one of the things that makes it different than other therapeutic tapes, is that not all the tapes have tension built in. So if I applied this just straight from the paper, you would already have 10% tension on your skin. So when we say stretching it to 25% tension or 30% tension, that's on, we have to be mindful that there's already 10% tension built in. The greater tension you apply, the more likely you are to have some skin irritation. That doesn't necessarily have to be a problem, but it's something to be mindful of. And some of the applications kind of call for a higher tension and tensile strength. But it's always something that with the pediatric population, especially those with sensitive skin, that I'm mindful of, because I don't want to cause an undue skin irritation if I don't have to. So in terms of applying it, you saw me probably just tear. This is my preferred way, because each piece of tape you'll apply kind of with an anchor piece to start, which won't have any tension, just to get the skin adhere to the skin, or the tape adhere to the skin, and then you'll have an end piece. And this middle piece we call our therapeutic zone, and that's the piece that you're going to be stretching. So I find it most easy to just strip it into thirds so that I can apply the tape here and then peel the other pieces. If that doesn't feel great for you, you can do the rolling method. So you would just peel the backing and then roll it down. I find it's really hard to manage the tape that way personally, specifically with like a pediatric patient that maybe doesn't want to sit still or has a hard time holding their body in the alignment that you want, because it's maybe a not natural alignment. So I find that rolling it and then trying to manage the tape is a little less ideal. But technically it is a method that you can use. One more piece of information that's not on here is that I always recommend rounding the edges. So just kind of snipping and rounding the edges on the tape as such will allow for the tape to adhere a little better. So if you look at this versus here, this gives more of a place for the tape to peel from the body. So if we round the edge, it'll A, be more comfortable, and B, it'll be less likely to peel from a child's body or an adult's if we have those rounded edges. In terms of removing tape, there are 3 different methods that we can use. You can either provide pressure, so you'll see in this one, you're pushing pressure on the tape and then pulling it parallel to the direction of the body. The second method is kind of rolling it over itself. So you're just peeling the tape, rolling it over itself. And then you can also do kind of skin from tape method. So holding the skin down, kind of pulling it taut a little bit, and then peeling this tape up naturally. I think that's what most people think of when you're like removing a difficult bandage from a kid's child, is kind of like holding the skin and then peeling the tape back. I usually use that one, or I kind of do that pressure method and pull it off. Never use heat to remove tape. Heat actually, it activates the adhesive on the tape. So when we put tape on anybody, we rub the tape to activate the adhesive so that it sticks a little bit better and the therapeutic processes start to begin. So never use heat to remove it. And never could do a quick peel. So sometimes, especially for an older kid, they'll be like, just pull it off. Don't do that. Removal of the tape is actually really important to decrease the amount of skin sensitivity and skin irritation that you get from the tape. So it seems unfortunate, but doing that slower peel is going to be better for skin healing and skin irritation in the long run. Another caveat to that is to be mindful of a kid's sensations when you are removing and applying tape. So if a kid has really heightened sensations on their arms or their legs for whatever reason, being mindful that the tape is going to have a different impact on them and their sensory system and their tactile system, especially when you're removing it. If that is the case and it is really difficult, you can apply any type of oil, even like an olive oil, to the tape and let it sit for a few minutes, and it'll help dissolve the tape or the adhesive so that you can peel the tape off a little bit more easily. One other strategy that people have found helpful is to do it when wet. So after the child has bathed, but before the tape has dried, you can remove it. Because if the take a hot bath and it was warm, don't let the adhesive dry. But if you remove it right away, it can be a little bit easier when it's wet. So common applications. Now we've talked about what we can use it for, how to apply it, what's contraindicated, and how to remove it. What are some common ways we could use it for this ASXL population? So one of the first ones we can do is the cervical spine. So this is a Y strip starting down here by the shoulder blades and then strip coming up on either sides of the neck. This is a really, really underutilized but excellent application of tape. It can improve posture of the head and neck and the positioning for both decreased pain. So if you have kids that kind of have some of that kyphotic posture or kind of slumping, we can provide that tape to kind of indicate some tactile cueing to pull that posture up for decreased pain. But also it supports so many functional activities if we have a better head and neck alignment. So if you think about feeding and eating safety and engagement, if we're sitting up taller, it's going to be so much more easy and safer to engage in that activity. Also thinking about social participation with their peers, if they're sitting at a table and they can bring their head up more safely and actively engaging. Even the use of an eye gaze device is going to be more successful if we have that cervical tape on our spine. So this is one of my favorite ways because not only is it usually promoting comfort, but it also is really helping engage in those functional activities. Another option is using the wrist. So we put eye strips across the wrist, and this can both improve alignment and decrease discomfort from contractures or decrease the incidence of contractures, but also improving that functional alignment for the use of the hand. So anything as far as like coloring, painting, playing, grasp and release of a toy. So if we have that hand up here, it's going to be so much easier to grasp a toy or engage with our environment or self-feed. But also something as simple as like utilizing a power wheelchair if we got a joystick and our wrist is in alignment, but also promoting the wrist if we kind of put it into that deviation, and then using a power chair is going to also be more easy if we have that wrist in that optimal alignment. So using a manual chair, a power chair, just to mobilize in your environment more independently by simply placing the wrist in the more optimal alignment. And again, like I mentioned at the beginning, we can also tape a wrist, but we can also tape into the finger too. So if we want to work on isolation for tapping something or tapping an AAC or pointing, etc., we can also tape all the way up to the finger to get that finger isolation for also increased functional use. Paraspinals and abdominals. So the straps look very similar. So I just have one picture of paraspinals, which are the muscles that surround your spine. So they're itty bitty muscles. They're on either side of your spine right here and often underlooked. But the thing about the paraspinals is that if a kid or adult has a hard time activating the correct muscles, the paraspinals will overactivate and try to stabilize that spine safely when the core or the lats, which are your other big back muscles, aren't activating the right way. So taping the paraspinals is really about supporting decreased pain and inflammation to calm those muscles down in the back. But it also can be used to promote better alignment. So if a kid has either kyphosis or scoliosis, we can kind of give those tactile cues, which is really all they are. We're just kind of giving a tactile cue on the spine to say, hey, sit up a little taller, which also will over time decrease any pain or discomfort. Also promoting that activation to kind of sit up taller to engage with their environment as well. For the abdominals, it'll look the same. We'll have two strips on either side, but we'll start closer down by their pelvis and then tape up towards past their belly button. So similar parallel strips. And that'll activate those rectus abdominis, so those six-pack abs, to really encourage the abdomen to turn on. It's really effective. And then this strip parallel, perpendicular, excuse me, you can tape the transverse abdominis, so that's lower pelvic muscle, right across your pelvis. And that will really also support something really important, I think, which is bearing down to promote a bowel movement, which I know that many children with neuromuscular diagnoses have a hard time with. So sometimes activating through those abdominals can give that tactile cue of like, hey, push here, and kind of give that reminder to turn the muscles on to support that really important but like difficult to cue movement of bearing down in order to have a bowel movement. It also can support all the things like sitting up straight and core activation while walking and stability and balance and whatnot. But I know that specifically sometimes that constipation can be a really big challenge for families and be really difficult. So it's one that I always like to mention trying and seeing if it works for your kid. It doesn't work for every kid, but it is something, a really low tech way to maybe try to support that. I know I've talked a lot about upper body things. I am an OT at heart. However, there are a lot of ways that we can use Kinesiotape for things like walking, standing, balance, etc. So one of the ways that I have used it specifically during my time at Napa for things such as like DMI and other like gait training and first walkers and things like that is supporting the ankles. So you can tape the ankles either to give a tactile cue, or again, this is something that we would support into optimal alignment. So if a kid kind of has that inversion where they're in toeing or flat feet, we can kind of bring those ankles more into the optimal alignment and then tape them in that alignment. One of the really beautiful things about tape, because it doesn't restrict range of motion, is that we're taping in this area, but the kid can still go back into that natural resting posture. The thing about that though is that the tape was taped in this position. So if the kid comes back to that natural alignment, the tape is going to give that cue to pull that ankle back into the optimal alignment, because it won't feel as comfortable to sit here when the tape is like cueing you to come back up. And that's one of the beautiful things about tape, because it does that for any position you put it in. Once you tape it in the alignment you want it to stay in, if a child or an adult slumps back or moves back into their natural position, the tape is going to give that cue and kind of give that force to be like, no, do the opposite. And I think for the feet and the wrists, that can be really helpful to kind of bring them back into a more optimal alignment that's a little bit more functional. And then as we know, neuroplasticity is so strong. So the more times that they do that and they keep those ankles maybe flat or have them activated to stand and step and balance, that'll become a more natural resting posture. It also really, the feet are so sensitive to tactile input and sensory input. So taping the feet and the ankles is going to be giving a lot of sensory input to those feet and those ankles for their proprioceptive awareness, or where their body is in space, and then the tactile cue and the sensory information on the bottom of their feet. So this is a really efficient way, again, to provide all those cues without having to do something like a neuromuscular stimulation or other really intensive kind of modalities. We can use kind of a low-tech solution that might have really great benefits, again, depending on the kid. Something to keep in mind that I think is really well shown in this picture is that every kid has a different size body. So sometimes these 2-inch strips are going to be too fat. So if you have a kid that maybe has smaller, joints or smaller body, you are absolutely more than welcome and encouraged to cut this in half. So usually they have about a center line, but you can cut it in half to make a 1-inch strip that might be more fitted to the kid's body and be more therapeutic. So something to keep in mind as you see those little ankles over there, that probably cutting these into 1-inch strips for it to be a little bit more therapeutic. The last one I'll share is for shoulder instability, because again, I know this can be a pretty common thing with kids that have a neuromuscular diagnosis. This is a pretty complex taping setup. It doesn't always have to be this many pieces of tape or this complex, but this is really just to support that shoulder instability. So if you have a kid that has some subluxation where it's coming out, Again, we can put it into the optimal alignment and then provide the tape to kind of hold and support the shoulder there while we work on strengthening the supporting muscles. And that's one of the best things about the tape too, is that we're not just doing it as a solo modality, we're doing it in junction with other therapies to support strengthening and kind of hoping to fade the tape eventually. And I think the shoulder is a great example of that. So we're going to tape the shoulder into support so that we can work on safely strengthening the surrounding muscles so that we can maybe fade the tape's use eventually. So with that, I'm going to pass it to Laura and stop sharing.
Thank you so much, Ellie. That was brilliant. Really appreciate you sharing your expertise and like so many different use cases, even beyond what I could imagine. So I think this will be such an incredible resource for everyone. Really appreciate that. Let me share my screen. Can you see my screen? Okay, great. All right, so I'm going to share a little bit about our son Alex for context, and then some of the uses that we've had with Kinesiotape and some pictures. As Sarah mentioned earlier, Laura Badmaev, I'm the founder of our foundation, chair of the board of directors, but most importantly, mom to Alex, who has Boren-Jobert syndrome, is A6L1. So Alex has global developmental delays, so he uses a lot of equipment. He has a wheelchair and a stander and a gait trainer, so a lot of assistance is needed in that space. He has an ulnar deviation, so like on his wrist, it kind of tends to be more curved like that. Thoracic kyphosis, so more of this spine curvature where he's like leaning forward more often, right? And hypotonia, so he doesn't really have a lot of strength in his muscles. So this K-tape has been really amazing for us. So I met Ellie, as she mentioned, at the NAPA Center, so Neurological and Physical Rehabilitation Center. They're all over the world. They have these incredible intensive therapy programs, and we're so fortunate to meet Ellie there to have a specialized K-tape session. And so I was able to take a lot of pictures and videos and share those with our local therapists so that they can try to start implementing them. The main uses that we used while we were there, so one, as you mentioned, from like a gross motor perspective and physical therapy, we use this to help with like his spinal support, so that like Y cup picture I'll show in a moment, and that really helps because Alex needs a lot of different supports and cues for walking. There's a lot of different things going on between like your head and your trunk and your legs and your feet, and so we would love to all be octopuses, but it's hard to manage supports in all those different areas. So having that like K-tape on his spine was really helpful to provide those cues and additional support doing those type of exercises. Also from a fine motor perspective, so we've tried lots of different types of braces, and they're great. But what I love about the Kinesiotape also is just it's so much more seamless to your skin, whereas there's usually like space with the bracing, and it's not as like customized in the same way that you can do more easily with the Kinesiotape to ensure like better positioning, so you're not you're like more in that right space. I think it would help with like some stretching, and so Alex was able to do a lot more interactive things with his hands, whether it was like feeding or playing or drawing. So I think in terms of the uses, the main uses that we had at that time were for like providing additional support in his body, ensuring the right positioning, that stretch, and a lot of benefits, many of which she's listed here, not as much pain. And I can attest to this personally, as I've used a Kinesiotape post ankle surgery, and it does really make your body feel a lot more supported. So something, if you do get some of this, might be interesting to try for yourself as well to see. I think it allows your child to participate more in a lot of different activities. And like I said, less hands and more seamless in the bracing. So these are a couple pictures during our stay there. So this is an example of that Y tape on his back to provide that additional support and some of those gross motor activities. On the top right here, you can see, like, as I mentioned, he has sort of that tendency to have this ulnar deviation. So like getting better correct positioning for his body. And then and this bottom right, he was doing this assisted drawing with guided hands. And so being able to participate and do more fine motor skills. So that was a really cool experience. And then, so this is the one that we use, the Kinesio Gold, this blue one here. And then I just also included a link for the guided hands. So I would say we mainly, like I said, have used this in a therapeutic perspective. But as listening to your presentation, I was also thinking about, like Alex has had hip surgery, he'll eventually have spine surgery. Like there's so many different uses, I think, for our children that can help probably afterwards as well, not just necessarily for some of these like preventative therapies. So it's a great option, highly recommend it. The tape you can buy on Amazon or direct from certain vendors online, and it's been really effective for us. So great.
Thank you so much.
Yeah.
And Ellie, oh my goodness, that was just so informational and detailed, and like my mind is kind of blown right now. I have questions, but I want to open up to other parents or anyone else on the call. You can just shout out or put it in the chat, and let's get some of these questions answered.
Well, I would like to thank you for bringing this topic. Never before I heard about it. I've seen it, but I never got a recommendation by any physician or any of the therapists. Gabriel uses those SFOs for correcting his feet that they go inwards, and but he usually removes them when we get home right away. So I believe that the tape could be a great combination of therapy for him, because discuss with the neurologist the way of maybe fixing this with surgery, but I don't think it's the best solution for us at the moment. So giving him the extra help when he removes those, especially the days that he doesn't have a school, it's very difficult for him to have those in place. So I'm really grateful for this topic, and thank you for recording it. I already shared it with the groups in WhatsApp, and I'll see if the parents, Spanish speaking parents also will be interested in me translating this for them. Thank you so much.
Thank you for sharing. Yeah, I think it is a great, like you said, like an additive bonus benefit to use when maybe on weekends or for those days when a child is just really having some discomfort and doesn't want to wear their bracing for whatever reason, which is totally natural. And I think if you use the tape instead, then we're not like a zero and all or nothing sum game. We can at least have a little bit of that benefit, specifically if you're not looking for surgery at this time, then this can still be a very supportive use to kind of give some of that benefit without having it to be a full brace.
Also, I spend many hours sitting, seeing patients myself, and I work at the university also all day long. So I think the Y-cat, it would be great for my back and my sitting position too many hours. So I also will take advantage of it. Thank you so much.
The Y-cut is my favorite for me personally, so I highly recommend putting that tape on your cervical spine.
I have a very practical question, Ellie. This was wonderful. I've learned a ton. So if families are interested in trying this, how do they start? I mean, it sounds like you can buy this tape on your own, but is this something you should do under the guidance of a physical therapist or an occupational therapist? How do you know the tension is right? So how do we sort of practically take this into somebody's life after hearing about it here?
Yeah, great question. I would recommend finding an occupational or physical therapist that feels comfortable applying it. I think that can really vary on the comfort level of the therapist. Not all therapists, specifically with pediatric clients, necessarily feel really comfortable. So I think that's kind of an area where you kind of shop around potentially and be like, hey, who feels comfortable trying this? I know it's supposed to be therapeutic. I think something you can take away from this webinar is that I would always start with less tension. So for any kid, I would always start with something between like a 15 to 35% tension and see how the kid responds. That's still going to be better than nothing. In theory, the Kinesiotape method recommends for like a joint, like Alex's ulnar deviation is pretty significant. So if we were really taping that for an adult, I'd probably have anywhere from 50 to 80% tension to kind of like hold that in place. That's just a lot for a kid. A, their skin integrity is not the same as an adult. B, their tolerance is not the same. It's a lot of things. So I really, even for when I'm doing like a joint stability, I always kind of err on the side of caution of no more than a 50% for any kid. So if you're feeling like you want to try it, A, feel free to reach out to me. I can have Sarah send out my email so we can even set up another call and do a consult. I'm happy to do that. But B, if you are going to apply it, just really make sure, and you can tell a therapist being like, hey, I don't want it more than like 50% tension. And kind of just like be that advocate because it's going to be safer for their skin and you're still going to get benefit, especially on those little pediatric hands and arms and legs.
So the tension is something that you need to be trained to know, like the percentages of the tension.
Yeah, so that's something that's really discussed in the courses. And really, it's something that, in theory, when I'm evaluating a person for the use of K-tape, it is an evaluation and assessment of like what is appropriate, where are the restrictions in the body, what are we trying to find, what's the therapeutic goal. And based on all of that assessment and evaluation, that's where I'm determining what type of cut I'm doing, what my therapeutic area is, and then how much tension I want to apply. As you get really comfortable, and as Laura can probably attest, you kind of get to know certain tapes in different ways that are really therapeutic and beneficial. So like Laura probably feels like she could K-tape Alex's wrist and his neck and it would be fine because she's seen it enough times. She kind of understands the mechanism. And I think that's appropriate for home. Once you've kind of seen it a couple of times, you've had the guidance of a therapist. But the first few times it really is an evaluation of like, what are the restrictions? What are we trying to promote? What's the functional activity and gain that we're trying to get from this? And that kind of really determines the cut and the tension of the tape.
My other question or thought is, my Sammy is a very hairy little man. He's like a baby gorilla. And so thinking of putting tape all over his body just makes me kind of like, oh, cringe a little bit. So how, like I know you said he activates it. How sticky is it compared to like the tape they use to tape an IV on your hand? Like what's the comparison there?
I would say it's about similar, if not like less sticky. Like the more you touch it, the less it already is going to start being adhesive.
Okay.
For kids, and especially as I get older, if it really is a concern, and like in adults too, even in my class, I had some middle-aged men when I was doing my course, and we're like, we're going to have to shave that. Kind of like when you're applying an AED, you might have to shave the area. So if you're concerned, I would either say like find another way to find therapeutic benefit, or as they get older into adulthood, you can always kind of like shave down the area if that's going to be more comfortable. But I've never had an issue with like this being super adhesive on like a younger client and not in their teens and like having it ripping out at a significant amount of hair.
Yeah. Sounds good. Anybody else?
Ellie, have you also seen this used in a post-op capacity for like after someone is having an orthopedic surgery, like providing additional support at any point from like the recovery, maybe even if it's not right away, but at like some future point in time to help?
Yes, absolutely. I think it's underutilized, again, especially in that pediatric population. But it definitely can be really supportive post-op, specifically for like spinal surgery, supporting the muscles on the spine to kind of give that activation to get them active again. If you think like even like after an appendix, like an appendectomy, like taping on the abdominals to help support healing. And again, also any orthopedic surgery, you're going to have so much swelling. So doing any therapeutic taping for lymphedema and swelling and bruising is also really helpful. And those ones, I would say for like swelling and bruising, always, always, always find a practitioner that kind of understands that system and how to do it. But I think it would be a really supportive way if we got more people to kind of buy into the use of tape in that post-op world.
Absolutely.
Any other questions?
Anybody else?
It was fantastic, Ellie. Thank you again so much. I think this will be an excellent resource that many people who have not heard about K-tape before, it will be something that we will share. It's been really beneficial for our family, and I hope a lot more people can use this.
Yeah, thank you so much, Ellie, and thank you for the gift of your time. I know that you've put a
welcome.
lot of thought and planning into this. You met with me ahead of time to learn more about ASXL related disorders, and so that's a gift to everyone on this call, but every parent who's going to benefit from this. So thank you so much.
And I've been messaging Sarah a list of all the doctors and providers that we need to share this recording with when this is over. Who are part of our research
Absolutely.
network.
Absolutely.
More
I'm going to
people
get a
that know,
list
the
of
better.
yeah.
Yeah.
Awesome. Well, thank you everyone for joining us today, and I hope everybody has a great night.
Thank you.
Thank you,
Thanks, Laura.
everyone.
Thanks, Ellie. Thanks, everybody, for being here.